Bird flu, also called avian influenza, is a viral infection that can infect not only birds, but also humans and other animals. Most forms of the virus are restricted to birds. H5N1 is the most common form of bird flu. It's deadly to birds and can easily affect humans and other animals that come in contact with the carrier. According to the World Health Organization, H5N1 was first discovered in humans in 1997 and has killed nearly 60% of those infected. Currently, the virus isn't known to spread via human-to-human contact. Still, some experts worry that H5N1 may pose a risk of becoming a pandemic threat to humans. Causes. Although there are several types of bird flu, H5N1 was the first avian influenza virus to infect humans. The first infection occurred in Hong Kong in 1997. The outbreak was linked to handling infected poultry. H5N1 occurs naturally in wild waterfowl, but it can spread easily to domestic poultry. The disease is transmitted to humans through contact with infected bird feces, nasal secretions, or secretions from the mouth or eyes. Consuming properly cooked poultry or eggs from infected birds doesn't transmit the bird flu, but eggs should never be served runny. Meat is considered safe if it has been cooked to an internal temperature of 165 F 73, 9th C. Symptoms. You may have an H5N1 infection if you experience typical flu-like symptoms such as cough, diarrhea, respiratory difficulties, fever, over 100.4 degrees Fahrenheit to 38 degrees Celsius, headache, muscle aches, malaise, runny nose, sore throat. If you are exposed to bird flu, you should notify staff before you arrive at the doctor's office or hospital. Alerting them ahead of time will allow them to take precautions to protect staff and other patients before caring for you. Risk factors. H5N1 has the ability to survive for extended periods of time. Birds infected with H5N1 continue to release the virus in feces and saliva for as long as 10 days. Touching contaminated surfaces can spread the infection. You may have a greater risk of contracting H5N1 if you are a poultry farmer, a traveler visiting affected areas, exposed to infected birds, someone who eats undercooked poultry or eggs, a healthcare worker caring for infected patients, a household member of an infected person. Get free healthy product samples plus nutrition and fitness tips. Simply sign up for our newsletter. Diagnosis. The Centers for Disease Control and Prevention, CDC, has approved a test designed to identify avian influenza. The test is called Influenza A, H5, Asian lineage, virus real-time RT-PCR primer and probe set. It can offer preliminary results in only 4 hours. However, the test isn't widely available. Your doctor may also perform the following tests to look for the presence of the virus that causes bird flu. Auscultation, a test that detects abnormal breath sounds. White blood cell differential, nasopharyngeal culture, chest X-ray. Additional tests can be done to assess the functioning of your heart, kidneys, and liver. Treatment. Different types of bird flu can cause different symptoms. As a result, treatments may vary. In most cases, treatment with antiviral medications such as oseltamivir, Tamiflu, or zanamivir, Relenza, can help reduce the severity of the disease. However, the medication must be taken within 48 hours after symptoms first appear. The virus that causes the human form of the flu can develop resistance to the two most common forms of antiviral medications, amantadine and rimantadine, flumidine. These medications should be used to treat the disease. Your family or others in close contact with you might also be prescribed antivirals as a preventive measure, even if they aren't sick. You'll be placed in isolation to avoid spreading the virus to others. Your doctor may place you on a breathing machine if you develop a severe infection. Prevention. Your doctor may recommend you get a flu shot so that you don't also get a human strain of influenza. If you develop both the avian flu and human flu at the same time, it could create a new and possibly deadly form of the flu. The CDC has issued no recommendations against traveling to countries that are affected by H5N1. However, you can minimize your risk by avoiding open-air markets, contact with infected birds, undercooked poultry. Be sure to practice good hygiene and wash your hands regularly. The FDA has approved a vaccine designed to protect against the avian flu, but the vaccine isn't currently available to the public. Experts recommend that the vaccine be used if H5N1 begins to spread among people. Outlook. The outlook for bird flu infection depends on the severity of infection and the type of influenza virus causing it. H5N1 has a high mortality rate, while other types don't. Some potential complications include sepsis, a possibly fatal inflammatory response to bacteria and other germs, pneumonia, organ failure, acute respiratory distress. Healthline newsletter. Bird flu. Medically reviewed by Deborah Sullivan, PhD, MSN, RN, CNE, COI on 14/2017, written by Bree Normandin. Symptoms, causes, risk factors, diagnosis, treatment, outlook.